Are you feeling tired or depressed or maybe brain fog, but you've been told your blood work is normal and your iron stores are normal? Well, did you know that there might be a blood work really important clue as to why you're feeling this way? Hi, I'm Dr. Patricia Mills, medical doctor with a focus on holistic health and hormones using natural root cause solutions to help you transform your health. And welcome to the Wild Wisdom Show. Today, the topic of the show is tired and depressed with normal iron. Low ferritin could be the missing link. So, did you know that it is possible for you to be experiencing iron deficiency with a normal iron panel in terms of normal iron stores, iron binding, iron saturation, and other measures? And the reason is that ferritin is this tool that we can use to assess our iron stores, but actually, it's the very first one that can start to go down, even while your other iron store values on your blood work are within normal range. And what we've been learning is that when you have normal iron stores, but your ferritin is low, and we're going to cover what that value could be, you could actually start experiencing problems with low iron. And those include being tired, having some brain fog, the brain really not working optimally because it's very sensitive to low iron stores. Also, the thyroid hormone could be suboptimally working, not producing as much thyroid hormones as it would like to. And those can be the initial signs of that low decreasing iron stores while you still have what looks like normal iron amount. But ferritin, which is one of the proteins associated with the use of iron and the way that the body uses iron, could be the very first sign that you're getting into problems with iron deficiency. Sometimes people will look to the red blood cell, or in other words, hemoglobin being low, to explain why one could be tired or fatigued. But you can actually have problems with those symptoms, even if your red blood cell is normal and you haven't been diagnosed with anemia. And that would be the case again if you have either low to normal iron stores and your ferritin is low. Interestingly, having low ferritin, even in the case of normal iron stores, has been shown to be a significant risk factor for depression. And so women who have low ferritin are more likely than women who have high ferritin to experience symptoms of depression. And this is really important because people wouldn't normally link problems with mood with low ferritin, but actually it's been very, very well measured and very well studied. And the other interesting thing to know is that ferritin is useful to understand both when it's really low and when it's really high. So if you have normal to low iron stores, but your ferritin is really high, so let's say over 300, and that's the measurement is micrograms per liter, then you can start to get suspicious that maybe the low iron or the problems with fatigue is due to some underlying inflammation. Because ferritin is one of those very interesting markers that while it's involved in the use of iron in the body, it's also an inflammatory marker. And when you have certain kinds of inflammation, ferritin will start to go up. And when you have inflammation, even though the body has what we can call normal iron stores, it can't use those iron stores properly. That's one of the downsides of chronic low-grade inflammation in the body. And so understanding both low and high ferritin can start to give you the key for that depression, fatigue, and brain fog. And it's not that you need to have all of those things. People experience it differently, and these can be hidden signs that are especially common in women and can often be missed. So the ferritin level that one wants to aim for is to have a minimum of 35 micrograms per liter, because lower than that has been shown to increase the risk of depression in adolescents, for example. And if it's really low, it can increase the risk of things like postpartum depression. So we want to aim for a fairly healthy over 35 micrograms per liter ferritin, but not too high. And, you don't want it to creep up over 300 because, again, that could be a sign of inflammation. Now, there are other blood markers for inflammation, things like high sensitivity activity C-reactive protein, or in short, it's called HSCRP. The platelets can go up, cholesterol can go up, there's homocysteine and lipoprotein A. All of these things are different markers of inflammation. And when people have inflammation, it's really interesting to see that it's unusual for a person to have all of those markers abnormal at the same time, unless they have really bad inflammation. It's more common that an individual will have one or two markers that are showing signs of inflammation, because inflammation is mediated through the immune system. And depending on which part of the immune system has been overactivated and whether it's in the brain, in the muscles, in the joints, in the ovaries, the testes, the liver, and so on, it may or may not be inflammation that spills over into the blood. And different parts of the immune system create different markers of inflammation. So that's why it's not extremely clear cut. You have this. Yes, you have inflammation, but there are some very obvious signs like the HSCRP being high, ferritin being way too high, cholesterol starting to climb up, maybe developing some problems with insulin resistance. And then you start to get what's called an inflammatory pattern. And that's when you start to realize that inflammation can start to block our body's ability to do things like use our available iron stores properly. And that can be contributing to multiple symptoms in the body, both directly due to the damage of inflammation and indirectly through inflammation's effect on other body parts and their function. So what can you do? Well, first of all, if one has a low ferritin, below 35 micrograms per liter, one thing is to start looking at how can I optimize iron absorption from my food? And there are very specific strategies both for omnivores, vegans, and vegetarians, and even carnivores can get into iron deficiency because of maybe the way that they're eating their food. There are certain foods that block iron absorption and certain foods that, when in combination with iron-rich foods, enhance the absorption. So really dialing down on the nutrition strategies and, if needed, supplements. Now, I prefer a nutrition approach first and then supplements if needed. You can overdose on iron supplements, and one very simple tip for iron supplements is to take it every other day. But I also have many other videos on this topic, one going exclusively into the nutrition strategies, one going into what kind of iron supplement is best to take, both for absorption and minimizing side effects like constipation, and simple strategies you can use like the every other day dosing that will actually enhance your absorption of iron should you need it. So go explore my playlist on low iron. You can check that out on YouTube. Go to Dr. Patricia Mills, MD, or at dr.patriciamills. Subscribe while you're there. Save this video for future reference and explore my playlist. You never know the kind of wild wisdom you're going to find that might revolutionize your health. And the takeaway here is that, listen to your body. If you're not feeling well, even if your blood work is normal, it's important to actually pay more attention to your body than to your blood work, because blood work is very limited. And while there are little clues like the ferritin, for example, there's so much that we can't test in the blood yet. And also there's a lot of chemistry that happens in the tissues that won't ever show up in the blood. So remember that your body wisdom is the most important thing here. Pay attention to that, respect that, honor it, and use it as a catalyst or an opportunity to start searching for solutions. And the natural root cause solutions are the ones that are probably going to serve you best over the long term. So if you enjoyed this video, this episode of the Wild Wisdom Show, please subscribe. That's the best way to support this show. Save and share. Sharing is caring, and you want to share this wild wisdom with your friends, family, and loved ones so that everyone can benefit from a longer, happier, healthier life. Hope you enjoyed this. I look forward to seeing you next time.